Trump's public health gag order scares doctors. Donald Trump's gag order on the nation's health agencies has sparked panic among public health officials and researchers. Hey viewers, welcome to Unboxing America. If you receive new information, please subscribe. After Trump was sworn in on Monday, his administration ordered federal health agencies to halt all public-facing communications, leaving public health officials fearful that they would not be able to inform the public about outbreaks of viral or foodborne illnesses, and that they would lose out. Outside. Funding everything from cancer treatments to vaccine development. Officials at the Centers for Disease Control and Prevention and the Food and Drug Administration are particularly concerned about the current bird flu outbreak, which has led to a 37% increase in egg prices compared to the same time last year. Avian influenza poses a risk to the public, especially if the virus becomes transmissible between humans. Likewise, doctors, scientists, and pharmaceutical researchers report that the government is canceling medical conferences and grant review panels, which could mean they will lose out on progress in cancer research to vaccine development. As reported by Stat News, several meetings of study sections at the National Institutes of Health, which reviews applications for fellowships and grants, have been cancelled without rescheduling, according to agency notices reviewed by Stat. The February 20, 21 meeting of the National Vaccine Advisory Committee, a committee that advises Department of Health and Human Services leadership on vaccine policy, has also been cancelled. A meeting of the Presidential Advisory Council on Combating Antibiotic-Resistant Bacteria is also scheduled for January 28 to 29. Norman E. Sharpless, former director of the National Cancer Institute, part of the National Institutes of Health, said peer review across study sections is required by law so that the NIH can spend most of its $40 billion annual extramural budget. If study sections and advisory board meetings are postponed for more than a brief period, it will likely disrupt grant funding, which is bad for biomedical research in the United States. According to a document obtained by Science magazine, it will expire on February 1st. But it's not clear how much freedom health agencies will have to communicate with the public when they roll it out, or whether the National Institutes of Health will still be able to fund it. Drugs and vaccines. That's because Trump's nominee to lead the Department of Health and Human Services is Robert F. Kennedy Jr., an anti-science job that has promoted unsafe consumption of raw milk and unsafe COVID-19 treatments. ProPublica reported that Kennedy wants to shift research away from infectious diseases and vaccines and said that the National Institutes of Health should focus half of its budget on preventive, alternative, and holistic approaches to health. More than 17,000 doctors sent a letter to the Senate, which has not yet voted on Kennedy's confirmation, warning that he was dangerous and should be rejected. This history is an affront to the principles of public health, the tireless dedication of medical professionals, and the trust that millions of Americans place in the healthcare system, the letter said. RFK Jr. has a well-documented history of spreading dangerous misinformation about vaccines and public health interventions, leaving vulnerable communities unpopular and threatening the lives of millions. His appointment represents a direct threat to the safety of our patients and the public at large. Unless 4 Republicans switch their votes against Kennedy, it would likely be confirmed. Thanks to the KOS Daily community, which continues to fight hard with Daily Kos. Your readers' support means everything. We'll continue to cover and inform you, so please donate as little as $3 to help support the work we do. Thanks for watching this video. Please subscribe to get more information.